When it comes to longevity of our teeth, or even of any dentistry that's been done, there are two main risk factors. Those two things are bad bacteria and force over time. Bad bacteria can produce acids that can eat away the tooth and create a cavity, chemicals that can stain or discolor things, and they can produce toxins that can create infections and abscesses that can break things down. And with force over time, teeth can chip, crack, break, wear down, or just wear out. We dentists generally do well diagnosing and addressing the problems associated with bad bacteria, but I believe that collectively our profession has not given equal attention with our general practices to preventing the long-term damage that imbalanced forces over time can create for our patients. Fortunately, there are protocols that we've built into the Marshall-Hansen method that can allow us to address these two risk factors. And if we effectively lower the risk, we'll inevitably increase how well things hold up over time.
Something I want to change about my smile.
I want to introduce you to Drew's case. As dental professionals, we probably see cases like this all the time. Significant tooth wear. What's really causing this? And are there steps that we can take our patients through that can help them minimize the risks of this type of wear continuing in the future? Let's have a look. If we want our patients' teeth and our dental restorations to be more resistant to fracture and hold up well over time, ideally what we'd like to see is that when our jaw hinges and brings our teeth together, that we would, one, see that all the back teeth are hitting at the same time, rather than one or some teeth hitting before others, and two, see that all of the tooth-to-tooth contacts on the back teeth would be centered and that there are no incline or deflective contacts. If when we hinge together, all the back teeth hit at the same time, they can effectively share the load. Understanding these two principles, we can then evaluate our patient's bite and determine within their particular centric hinge axis of closure if they have any premature contacts, teeth that are hitting before any others, or any deflective or incline contacts that could be triggers for high-risk forces. Through a simplified equilibrating protocol, we can then address these areas and systematically balance and direct those biting forces to our advantage. By eliminating any deflective or premature contacts, we encourage relaxation, coordination, and an overall more peaceful masticatory system of muscles, joints, and nerves in a more harmonious functional balance. This is especially critical in minimizing the truly detrimental high-risk forces that our patients' teeth and our restorative materials may receive. Less force over time will increase expected longevity. For years, I've been routinely assessing and balancing our patients' bites as an important component to their dental risk management workup, comfort, and longevity. I believe in it, and I feel confident that it is at least in part due to our attention to these functional forces that in the last 5 years, we have never seen the framework of an MHM veneer break. We could say all these wonderful things about the benefits of managing occlusion, but we wanted to see if we could show you with some real measurable data. So we invited Dr. Miles to come in and take some masticatory muscle readings on our patient Drew before and after our bite adjustment to show how immediate the results of an effective balancing can be, and then do a 2-week follow-up to see what notable lasting changes Drew experienced.
Let's go play.
Let's go play. Let's do it.
Midline is off, so that's the first signs that there's something wrong with the occlusion. I'm Miles Preble, and I bill myself as a cosmetic neuromuscular dentist. Relax, clench hard. Why do people need cosmetic dentistry? Because they've either been in an accident and trauma, or they ground your teeth down, usually in the sleep. It's just taking the readings. So I can track on the computer where the jaw wants to be with muscles relaxed. And if you get the bite in the proper position, headaches go away, migraines go away, back issues go away. We found that it's really stable. The symptoms totally go away or they're greatly diminished. And people aren't breaking porcelain, they're not knocking crowns off, they're not breaking veneers anymore. I've just found that it's the way to treat and we can measure it. I think it's a win-win.
Now that we have all of the electrodes placed on Drew's face, we're going to be able to read the activity of his muscles of mastication and be able to see what's active, when, and if everything's in balance or not. There's a little bit of suspense because I don't know if it's going to show what I think. It might be like, oh, well, there's no data for what you're saying, Dr. Hans.
Clench fast, hold, relax, and we'll do that 3 times. Just a touch more pressure, Drew. There you go, hold that.
Now we're seeing a graph of Drew's muscles at rest. Here in the pre-treatment, we're able to see that his right and left temporalis muscles are really hyperactive. There's a lot more tension there compared to his masseters. As we go along today, we may determine why that's the case.
He's firing both masseters, but the right one is firing a lot more.
Now we're seeing a graph of Drew's muscles in action. As he clenches together, we can see the muscle activity, and it's obvious here that his right masseter muscle is a lot more active than his left. We're seeing it register at 11.5 compared to 2.7 on his left side.
So he's clenching enough to fire the left side, but the right side is to fire so much more because of the extra pressure.
Based on these numbers, Dr. Miles would predict that Drew is hitting first on his right side. His right masseter is firing significantly more than the left, indicating a premature contact in the back on his right side.
So now get your paper out and test.
Yeah, so now we're gonna see. And then afterwards, after he's balanced out this with this initial one, we'll just reread it and see, yeah, if there's a difference there. Cool. It was exciting to see that just as the data had predicted, we did find a premature contact on Drew's right side. Here in the photograph, we can see the single premature contact on the second maxillary molar. This would have been responsible for the significant muscle activity on his right side that we saw on the graph.
Clench fast, hold, relax. Clench fast, hold, relax.
Now that we have completed Drew's initial occlusal balancing, we're looking at his muscles at rest, and on the chart we can see that now his right and left temporalis muscles are much more relaxed than they were before.
Spikes are taller, so the bite's more balanced, and on the one scan you'll see that left to right were more balanced.
Now in function, we can see that Drew's masseter muscles that were offset significantly before treatment are now firing at about the same time, indicating that the muscles of mastication are much more balanced and peaceful. Yeah, that's pretty cool to see that difference there.
Clench fast, relax.
2 weeks later, we brought Drew and Dr. Miles back in to redo the data.
Hold, relax.
We found that Drew's bite was still stable and balanced as before. So Drew, I was really excited to just kind of do a little experiment, really. For years, I've believed so strongly in the benefits of balancing bites and assessing bites and making that a part of this method, because I felt it was so important. And I talk about it a lot, but I just didn't have the data to say, like, this really works. So it was fun to have you come in with Dr. Miles and be able to set you up with all those monitors and measure your muscle activity and collectively see the data and see where you were hitting and which muscles were active, and then do this balancing and see the graphs and the data change. Like, that was really cool. I'd love to hear from your perspective what that was like.
Obviously, I feel a lot different. My mouth feels a little bit different, obviously in a good way. I wasn't sure what to expect when I went in there with Dr. Miles, because this is like the first time I think we had all done that.
Yeah.
He kind of hooked me up with everything, and you know, I just wanted to make sure I was doing everything correctly, because my bite was so off to begin with that I wanted to make sure I wasn't compensating when you would tell me to bite flat, and just wanted to make sure, and I think it took us a couple times to really start figuring it out.
Yeah.
And then I finally I kind of rested my jaw and I could tell a difference. And then as we kept working with the leaves, right, and you would put those in, I could start feeling a difference, like, instantly.
It's cool how instant it is.
Yeah. And then you were like, and then you told me, don't wear your night guard. Let's test it out for a couple weeks. Don't wear your night guard and let's see if you have less stress on your jaw. And I could tell after a couple nights, I mean, this was much more relaxed. Sometimes I'd wake up with, pain in both sides of the jaw.
Before?
Yeah, before. And after a week or so of that and getting the teeth done, I could tell a major difference.
I loved this step in the method. That in that first appointment, we get to do something that they get to feel immediate results with. We're teaching them things and doing things that they probably never heard or had done before in any other dental office.
Right.
And it creates this immediate value too of like, wow, like this is something different. But it's been really cool after years and years of doing this same thing, every patient, and seeing that it always works. Every time it's always better. And most patients do have some deflections. They have some degree of imbalance.
Sure.
I've had some patients who had been so troubled by their bite and headaches and migraines that balancing their bite was just as exciting to them as their teeth.
I felt that way too. And again, just before you even started the actual process on day 2, we were already doing this and getting alignment, and I already felt relief in my jaw, like instantly. And that must be really reassuring for you to again, you can see that and you can tell someone that and they can tell you, but to see the levels of stress coming from those nodes, I mean, that must be pretty valuable.
It was cool for me to see that because like I said, I believe in it and I see it work all the time, but I'd never seen the data,
right.
To like visually see the graph and be like, oh yeah, this is different. Here's the before graph and the after graph. So that was really cool. But then the other question that I had too was, okay, if I do this and we balance their bites, then weeks later, is there a relapse? Does it go back to the way it was before, or does it stay stable? And that was what I was excited to do the follow-up with Dr. Miles, to say, okay, it's been a few weeks, we haven't had any appliances, and then to see again after we got everything measuring and right again that it still was balanced and feeling good.
Yeah, it still felt normal, and it's great. I'm so happy. I can't stop smiling.
I love that too. Yeah, I love that.
Yeah.
Well, I think balancing the bite is so huge. It's important for longevity. And I love that we could restore your teeth. We've replaced what was lost. What had been missing and worn out.
Yeah.
We built that back without doing any damage to your teeth, and we've addressed some of the reasons why they were wearing out.
Right.
Acid and wear, unbalanced bite, and you've tackled the acid part.
Yes, no more soda.
No more soda.
Yes, we're 1 month clean from soda.
Yeah, I love that.
Yeah.
And then now that your bite's more balanced, I really feel confident that these teeth are gonna continue to hold up well for you for a long time. Likely decades.
Genuinely, thank you. It's kind of one of those situations where you don't remember, you showed me an image earlier of my teeth before, and I hadn't seen that since I had gotten these done. And yeah, just the biggest difference, more confidence. And if my jaw hurts now, it's because I'm smiling. It's not because I'm grinding them down.
What I hope that we could all see here is just one example of how a patient presenting with normal bone in a normal socket can benefit from a simple bite balancing protocol that I believe will not only feel better, but also allow Drew to preserve his teeth and extend the longevity of our dentistry.